welcome Dr. Pierce back to be with us. We really appreciate that.
Thank
Just
you
wanna
for the
start-
invite.
Do you just want to start out with the approval of the January 9th, 2025 minutes? Do I have a motion?
Ross?
Somebody? Russ?
Just because I'm the only one at work, all right? So,
Okay, all right,
snuggled up.
Tom, thank you,
I'll
Tom.
move.
I made a motion, I'll second
right.
it.
All in
Yay.
favor? All in favor? Aye, we're good? Okay. So before we get into, never mind. Let's start with the Health Department report. Please, Jen?
Okay, Jen Eielson, New Canaan Health Director. So I sent you all the reports. As you see by the numbers, the building permits have picked back up from December, went from 28 in December to 58 in January. So that's good news. Everything's, moving right along. The septic installs are down because obviously when the ground's frozen, it's hard to not only install, but then to backfill because the soil freezes. So that's why those numbers are a little low. We did get one new food service plan review for flour salt water that's proposed on East Ave at the old New Canaan Pizza Shop. So we're looking forward to that for a spring opening. They do have a bakery in Darien for those of you that have been there. We had one new non-elevated blood lead level environmental lead case in January that I'm working with the owner on the abatement plan for. For FEP grant update, I submitted the Q2 reimbursement of $22.29 and 29 cents. And we actually already got the check yesterday, which is like the fastest we've ever gotten paid. Now, just an update on the grants, because I'm sure you're all hearing media, confusion on everything. Most of the grants had pretty much been done in the last administration. So we weren't getting new grants before this new administration anyway. And the grant that we're working off of for currently with our public health nurse, the workforce development grant, that money actually was front loaded to us, which is rare. Normally it's a reimbursement. So that money's already in town coffers. No issues there. The only grant that's in question is the FEP grant, the Public Health Emergency Preparedness Grant, but that's only, a little over 11,000. So what I told our liaison meeting on Tuesday, if that grant goes away, it's no big deal. I was doing the work beforehand. I can do the work after. I'm not intending or asking the town to supplement that if the federal government does cut everything. We won't know for some time, but again, it's not the end of the world. We're not like the cities that are heavily dependent on federal money. So in this one time, we're actually kind of happy that we don't get much from the feds or the state. We did have Marcy and I, our liaison meeting with Town Council and Board of Finance on Tuesday. That video is on the town website. The Board of Selectmen presentation we did in January is also on the town website, as is our actual presentation itself. Tonight, we present the Board of Finance. Our budget's under 0% increase, so there shouldn't be any issue. Looking at other things, the community health is moving right along. On Monday, I'll be sending out through Everbridge to the health group a notification for next Friday. Is Valentine's Day. Coffee talk topic will be heart health, because it's also American Heart Month in February. So if you have nothing better to do on Valentine's Day or just want to learn about heart health, come see us. We can be your Valentine. And we also received 50 free radon test kits from the state of Connecticut. They got that through a grant through the federal government. So those kits have already been dispersed to all 50 residents. We actually had a waiting list of over 70 people, but unfortunately we only had the 50. And the results are already coming back, which is great too, because that's part of the grant deliverable that was also communicated in that Everbridge that, we need those results, but there's nothing actionable. So if your house comes up with elevated blood, with elevated radon, I can't order you to remediate that. It's more for you to make a decision and know what's going on in your house, which is, good news. Looking at all the charts, it's obviously no surprise that respiratory infections, flu, RSV and COVID are going up. It is that season. It is, we still have the higher numbers in the suicidal ideation, especially in that 10 to 17 group, as you all saw on the charts. So hopefully when the results of all the behavioral health study, we begin to, as a town, focus more on how we can get that addressed along with Silver Hills program and figure out, a better way. But
Can I interrupt you 1 second, Jen? I just got a text from Lauren that she's trying to get in the meeting, so Marcy, do you have the waiting room?
Oh,
No.
that's so much
there is.
responsibility. Let me
There
see.
she is.
Oh, no, she is here. Yeah.
I see her.
Okay, good. All right, good.
oh, hi, Lauren.
Morning.
Sorry to interrupt.
Oh, no worries. So any questions on it? And if you want to watch Board of Finance, there'll be a Zoom link tonight, or you can just watch the video after it's done. I go on at 7:30. I'm the first department to present to Board of Finance, and then Marcy's right after me.
Right, and we can talk about that at the end of the meeting, if people want to tune in, I got the information. All right, any questions for Jen? No, thank you so much. Okay, Marcy, turning it over to you.
Good morning, Marcy Rand, Director of Human Services. I'll keep this brief. I know Lauren's got lots of great news to share with us. Our numbers, third quarter, we are seeing a slow and steady uptick in clients. I now have 231 from 219 in our first quarter, and Jackie has 157 families with 162 children in total. Our domestic cases, we had 3 in January. And in January, our food pantry, we had 449 households with 99 total shoppers, and that was just for January itself. So we are definitely seeing an uptick in numbers. I won't go through all of our outside agency and meetings and all that kind of fun stuff. Like Jen said, we did our liaison meeting. That went well. We are both very proud of ourselves. We're both under budget, so they cannot, I mean, fingers crossed, they won't give us a hard time.
Mm.
Our Board of Finance is tonight, and I will be going right after Jen. I have a couple new programs starting. The first one is definitely written in stone. It starts the second Monday of March, and it will be once a month. It'll be open office hours with Catholic Charities, and they are going to be coming in and helping with budgeting and family loan programs. We've noticed that a lot of the residents have a hard time getting outside of New Canaan just due to transportation and stuff. So we do have an office that we are capable of having some open office hours for organizations that can help us with programs that we are not able to cover. So we are also working with Laurel House, but that has not been ironed out yet. But Laurel House will help with like employment and writing resumes and finding employment. And they'll be coming once a month also for people to drop in and work on that. And grants, as far as we are concerned, we are the Get About grant is for 5 years, so we don't really need to conquer that until 2028. 2028. I wish it were 2008. I wouldn't have this gray hair. So we don't have to worry about that. That has been given, as well as the opioid money that has also already been like earmarked for us. So we're okay as far as funding our outside agencies with our budget and our grant money. And
I just build on that, Marcy, for a second.
yeah,
I mean, I had a chance to look at your presentation and it's just, I just want to compliment you on what a good job you did of maintaining the spending level very creatively and using, all those other funds for, from the opioid. And I guess there was a Department of Transportation grant too.
yeah, that goes on. That's the one that has been given to us until 2028 to forget
Yeah,
about.
no, it's just, you did a terrific job, and you and your team of, maintaining that level of support. So
Thank you, Barb.
everyone should tune in to just see tonight.
Marcy, I just had a question. Domestic violence, I know that we've tracked and it's at 3, which is 3 too many, but I've also seen in the news more protective orders and people being arrested for that. I know there's a correlation, but is there anywhere that we track that as well?
We do get the police reports for those, and Jackie always calls in to make sure that the family has or is aware of resources. She can't do much more than that. but she absolutely does that with any police report that comes across our desk. So, yeah, we make sure that they are aware of the services.
Do we have a way of quantifying that in any way? The reason being, I know we're going to spend a lot of time on suicidal ideation and, you know, that age group that Jen referenced previously, and rightly so. I'm just seeing, you know, more and more press on these types of issues, which or there is a correlation between protective orders that are given and arrests that are made and domestic violence cases. So I just wonder, I don't want it to be onerous in any way, but
Right.
is there any way that we could have that? And the last part of my question is, we were also going to look at as we develop more workforce housing in the area, as we develop more housing in the area, multifamily housing things, is that going to have an impact on, you know, the number of services that you provide, you and Jen both, and what that's going to project and look like? Because as Barb has indicated, you know, while we've kept the budget flat, and you guys have done a fantastic job looking at alternative financing sources, at some point in time, we as a town and as a community need to realize that there's some targeted funds that are going to be needed for specific areas. And we just want to make sure we have all of our data and demand in place in order to support that.
Well, we have kept a line item for a part-time position. I don't know if you took a look at the budget. So if we find that we do have a demand for that, we have that in our line item. And Jackie is able to, she doesn't keep details. She keeps sort of a head count of contacts of who she's spoken to through police reports. If you look at on my last page, first quarter, she had 5 domestic violence cases. Second quarter, she had 6. This is only 1 month of our third quarter. We've had 3. So she definitely does reach out to them. Sometimes it's, unfortunately, it goes into the news, and sometimes it's not what it seems to be, and once she is able to speak to them, that's understood. So it's kind of confusing. A lot of things do fall under domestic violence, or, the police report will say this is domestic in nature and nothing else can be reported, but it was, possibly alcohol induced, slamming of doors or something that was sort of scary, but didn't need further investigation from the police. So Jackie will give resources. So it's really hard to actually quantify what.
Do we get any reports like we do for suicidal ideation? Do we get any reports for the emergency department or anything of that nature when it reaches that level of domestic violence?
I do not. I don't know if that is a confidentiality thing or,
So-
I don't know.
All I get is what the chart in there, the New Canaan community violence, but I get no identifying information behind that because they're not reportable diseases. So I can't know the specifics. But one of the charts in my report tells you the age range, but it doesn't tell you what the violence was or, the background. So you kind of got to take it with a grain of salt, kind of.
Right. Thanks, Jen.
Any other questions for Marcy? Okay, well, thank you. I know everyone's waiting for the main event, which is Lauren, but I just want to ask Peter, since he's part of the Behavioral Health Alliance, there's news there. I just want to ask him to just give a really quick update.
Yeah, just on the urgent assessment that you guys, we had a great discussion last time. There's a bunch of news there that, Westport's joined the program for a slot per week, which is very meaningful. That means maybe 4 or 5 folks. That's the goal. And that's, Lauren can probably comment on that. She's been in the middle of that for a long way. And the program's been renamed the assessment program at Silver Hill. And I think, well done, our group, and certainly the Behavioral Health Committee at the foundation really leaning in on that. I think it's a solid change, an important change, and again, just shows what great partners they are, that they really are listening and adapting just to make the program better. So some really nice news. The volume was 10 in January, a little lower than we'd like to see, but still, you know, a decent solid number. But I'll shut up after that and let Lauren.
Okay, so wait, no, but before Lauren starts, I have to introduce her, even though we all know her.
Oh yeah, of course.
Because I just think it's important to put what you've done today, or what you're going to say today, in context of your contributions to the community. She joined the foundation in 2016 as president and CEO, and early on she said we need to take on a community leadership role for the foundation to identify unmet needs and what spark systemic change. And the first undertaking was behavioral health, which was very fortuitous since it was right before the pandemic. And really was critical in responding, helping the community respond to those efforts with the money she raised and all the other activities that went on. And many of you were at last week's presentation, but we're really looking forward to hearing your report. And we are very grateful to have you in the community, Lauren, and hope that we can, as a commission, can contribute to these efforts after this survey going forward. So thank you.
Thank you. It's good to see you all. Thank you for having me this morning. You know, as Barb referenced, I do think a lot of you either were able to attend last week's public forum or have seen the report or a version of a slide deck at some point in time. So what I thought was I would kind of more quickly cover maybe some of the highlights that we talked about in our public forum, maybe share some interim reactions are to that content and where we're headed. Some ongoing planning for sure, because I will say the release is just the start of things. We still want this very much to be in conversation with the community and not assume that the data tells us we need to do something very specific as a response, but really double check any of those assumptions back with the community and really spend time answering questions because I know you all are thinking about some more detailed things and how you can proceed with the town. So just as brief background, so the New Canaan Behavioral Health Alliance was the administrator. That was the real strength of the survey process. This is 30 to 40 some odd organizations all joining forces to administrate this survey, which was really terrific. We put a lot of effort and time into communications and outreach. There's a lot of media. Town, really big thank you to both the health department and the human services department for blasting this out to their newsletters. That made a very big difference in response rates, we think. We also had several sites in town for paper distribution of the survey, which helped. And then we had individual advocates. Some of you were part of that process of just signing on with your name and spreading the word, which was, again, really helpful because for better or for worse, we've been surveying our town a lot on different things in recent months. And so we really had to hit home that this was important for adults in our community to participate. In terms of the responses, we had 1,490 usable respondents. That's about 10.5% of the 18 plus population in town, which is great. We didn't necessarily target that young adult population in town unless they were truly still living at home and kind of moving around in our community more than some others might be in that age population. They're counted in our census data, but they're not necessarily really living in New Canaan at the time. So I think that percentage is really good. Excuse me, and our researcher was really pleased with the response. It gives us a very good margin of error that's about 2.4%. The researcher did look at our census information and was also happy that the responses were generally representative of the community. So for example, in some of those slides, you saw, bar charts by age bracket. And we were pretty on par with how our community is broken down in the census information and then the responses we saw in the survey. We were a little bit underrepresented among the 18 to 29 population. That's for some of those reasons I just referenced. Also a little underrepresented in the 30 to 39 and a little overrepresented in the 40 to 49. I think that has to do with just where parents were and how they were engaging in this particular survey, maybe where they heard about it too. The researcher also spent time notably on looking at a couple of subgroup analyses. So she was always looking at breakdowns by gender, age group, and length of residency across all dimensions to see if that told us anything different about the respondents. But then we also looked at 5 unique categories. So one was multiple caregivers. So these were folks who responded that they were caring for a child, but also were additionally caring for a parent or another, potential, adult family member. So multiple caregivers, it was about 12% of respondents were caring for a child and a parent, 8% for a child and another adult. We also looked at a category around those who were reporting low financial security, those reporting low life satisfaction, those reporting a high concern for their own emotional well-being, and those reporting a high concern for their own mental health. So we wanted to make sure if people were self-categorizing in any of those ways, that we additionally looked at whether they were answering the survey questions any different than other populations that were not. So a couple of the kind of top line takeaways. So one was really around needing to increase awareness of some great programs and services and supports we already have in our community. We had a laundry list of things that people could tell us whether or not they understood these services were available locally. And so there was there's a chart with a long list of those things. What the Alliance has really zeroed in on are a couple of those things. So awareness of substance use services and supports, awareness of mental health supports, and awareness of domestic violence services and supports. And what was interesting, so it was about a third of the population saying they weren't aware of those services and supports, which you could say, okay, well, what is the awareness level we need? It's probably not 100%. You don't necessarily want to be seeking out some of those services, but we do want the general resident to know they're available locally. But what was interesting is when we had the researcher look more deeply and say, okay, well, if it was someone who expressed a concern about their own substance use, they were actually less likely to be aware of services and supports than someone who didn't have concerns about their substance use. So in that example, it's 41% who were concerned about their substance use didn't know what the services and supports available were, versus if you were in the general population, it was 37%. So it's a slight difference, but it was interesting. We've found similar with mental health. If you reported poor mental health, you were 41% were unaware of services and supports, versus if you weren't concerned with your mental health, 32% weren't aware with those services and supports. And then similarly, if you were reporting that you felt unsafe in your home with someone in your home, that was about 9% of respondents across the survey, which I would say is good that it's low, but that represents about 134 people who took the survey, right? So it's I would say, significant population. So if you were reporting you felt unsafe with someone in your home, you were less likely to be aware of services and support for domestic violence. That was 41% were unaware versus 34% in the general population. So again, we are resource and service rich, fortunately, and we just need to figure out why there is a gap in awareness for folks who specifically need that service. And it's helpful. Now we have a baseline of understanding. So this can help inform our outreach, what particular nonprofit partners who work in these spaces maybe do in terms of their outreach. And as part of the survey process, not just for this awareness piece, but other areas, we asked where you receive your information. So is it from the town of New Canaan? Is it from your health provider, social media, news outlets, where you were getting your information from? So now, for example, we can say, okay, if you're a woman in your 40s and this is a more detailed demographic makeup, this is the news outlet to target, so that audience hears this message, and so on. So we have some useful information, I think, to move forward.
Hey, Lauren, I'm a little struck by this theme of folks who might need it most are the ones who are less aware.
Mm-hmm.
Is there an isolation theme possibly around the groups who are most sort of in need? how do you square that? Because it's kind of counterintuitive, right?
I know. I don't know. It could be,
Yeah.
but I don't know for sure.
Okay.
Yeah.
Lauren, the vendor that you engaged to do this service, can they give us some perspective on other towns, other regions? Is this common? Are we an outlier, or where do we sit? I mean, I think slide 19 as an example is half of respondents believe underage alcohol use is a norm. Is that
Yeah.
typical?
Yeah, so we can for sure
atypical?
get to that part too. So
Sure.
yes, the researcher. So we used Chanana Consulting. This is an independent shop, but she does the survey process in a number of our local communities as well as elsewhere in the state. So that was really valuable to us because when we built the survey, it is unique in that it focuses on the adult population. Most other survey processes have focused on the youth population, and maybe eventually have added an adult component that now are administered side by side. But typically there are more youth surveys for us to compare with. But what you referenced, Russ, in terms of kind of community norms and perceptions, that is the stuff that she can most easily compare for us and help us benchmark. When she saw those figures, she said, you know, when you look, say, nationally, more affluent communities are those that have kind of higher acceptance of underage substance use and also higher rates. But the 49% in New Canaan is higher than other affluent communities that she has looked at. So culturally, it's a strong consideration for us.
Lauren, one question. So the most in need are the less aware. So when the numbers came out from the survey initially, and 30 to 50% weren't aware of the resources, et cetera, et cetera. And I asked the person who, and considering that Health and Human Services, 2 to 3 years ago, really emphasized getting information about their existence, plus all the resources, et cetera. When I asked the person that headed the survey, she said, well, the answer was, well, if you don't need it, you're not aware of it, which made sense in a way, but this counters this information too, because, so it's a little conflicting there.
Well, there can also be like a lack of motivation when you need mental health. I mean, if anyone has even had like a slight amount of like anxiety or depression, you kind of do isolate yourself, where you just curl up into a ball and you don't seek out services. So I think there's a component to that too. Do you know what I mean? Like, I think you may kind of in the back of your, vision know that it's out there, but wanting to get the help is like kind of monumental and exhausting to think of. And that there may be something there also.
Yeah, one of the things about an observation of mental health in general, particularly in families, speaking broadly, mental health is not something people want to talk about in a family, and the stigma and all the other problems that go with it. The other thing is generally just understanding what the benchmarks are for hair on fire versus just a normal adolescent grow up or normal family conflicts. It's a very steep learning curve in the last 5 years, and it's going to continue to be such, because one of the things is nobody knows what to look for. So there's clearly an opportunity for the education that the Alliance has already started, but obviously there's a lot better and more efficient ways we can do it. But it's a problem that's kind of a soft problem from history, and I can tell you with the seniors, nobody wants to be talking to a shrink of the men that I talk to. So that's a problem, because many of them have the same stress and emotional problems that so do the rest of the world, but they don't want to acknowledge it. So there's a problem, which I'm going to be talking to Barb about afterwards on this, looking at the implications of this study on the senior population per se.
A couple of comments. Hi, everyone. Good morning. A couple of comments, Lauren and I had spoken before about this, but a couple of things I think maybe too lend to this. Totally agree with Marcy. Also, I don't know all the questions in the entirety. I don't live in New Canaan and I didn't take it, but was one of the questions asked, have you been in prior like counseling or done that before? Because what we also find with a lot of our populations, like that Marcy and I work with, is they're not like if they're coming in with say more chronic mental health issues, they're not new to therapy, you know, or they've probably gone through a lot of like therapists, so they may not know newer sort of things that they could go to because they haven't, maybe they've been resistant to other therapists. One thing, not trying to make excuses, but that is a huge part of it. Also, I forget if Lauren, you could answer if those were the people that were newer to town that were in need, and I forget that part.
Mhm.
Also, one other thing, I think this was pre-COVID, Lauren attended this event. We copied an event that Darien had done at the library. We did women in alcohol, and we had Dr. Handler was on the panel, and a physician from Darien, and a lot of great people. And what the information that came out of that was majority of moms took this survey, and moms are the last ones to get help for themselves because they're caring for children, maybe they're caring for their parents. So it was more typical for like the husband to go into like a treatment but the moms were like, when can I do that? You know, so that's a part, and that could be a population we target. I had mentioned, to Lauren too, that I had gone to a talk unrelated, but it was after the suicide in the fall. A woman put it on at the library, and only moms showed up, and their kids were of all different ages. And it was sort of a neurodivergent theme, but other parents showed up with kids struggling with like mental health issues. And that Colleen Prosser and I attended. The tension, not the tension, but just you could feel the stress in the room that day of moms feeling like they're in this alone, helping their kids with their mental health because, you know, maybe their husbands are working and they don't have the time to discuss it. Like it was just like we could have been there for a workshop all day. So I think that that's a huge part but again, how do you tap into that? Who's going to come? I've tried to do divorce support offerings and no one shows up, you know? So it's like, we want to do these things and people need this help, but we've got to find another way. So that was just my 2 cents.
Yeah, I think so. Those comments those all align with, I think, what we asked specifically around, did you have barriers to accessing either physical health care or mental health care within the last 12 months? So did you have an identified need and you could not connect with that service in the past year? Access overall is good, but I feel like in a town like New Canaan, we could have a higher standard for, you know, any resident seeking out care. They should be able to. We did find higher rates of individuals not connecting with either physical or mental health care if you were a woman and if you were aged 30 to 49. So I think, Jackie, that connects with that mom parent population that is making trade-offs potentially with their health. The rates were also significantly higher if you were not just a multiple caregiver, but if you said you had lower financial security, you had low life satisfaction, or concerns about your emotional well-being and mental health. Again, those subgroup populations that we looked at. So for example, if you said you were concerned about your financial circumstances, 67% indicated they had a barrier to mental health services and 71% to physical health services. So that's, you know, those are high rates where financial stability really is driving a lot of those decisions. I don't think that's shocking information, but it's helpful for us to have that data. And overall, across all respondents saying that they had a barrier to either physical or mental health care, the top 3 barriers identified were that they either could not get an appointment, the cost, or that the provider didn't accept insurance.
Yeah. Question, among the people who've used the formerly urgent assessment program at Silver Hill, how many fit into this category of moms juggling all the challenges of life, suffering, maybe alone? my impression was not too many, but that it was mostly younger adults and a few older people, but not many of the sort of in the middle of life
Yeah.
people. Does that
That-
sound right, Peter, and others who are familiar with that program?
Go ahead, Lauren.
I was gonna say anecdotally, that sounds right. I'd love for like Silver Hill to comment on that, but I think anecdotally that sounds right. I know sometimes Susanna has referenced a child coming in for assessment and they do end up working with a parent. Right, a need surfaces that there's something going on with one of the adults in the family, and then they pull them in. But I don't know that I don't think it's been a primary audience.
Yeah, I mean, listen, adults 27 to 60 are only 27% of the urgent assessment community. So you can, however you want to cut the numbers, it's clearly underrepresented. It's still very much sort of, young youth focused, but there's a real gap, that community and the urgent or the assessment program.
Another factor is also that the high school is very active. Well, the New Canaan Public Schools are very active in referring to urgent assessment.
And if
Yeah,
I could,
there's-
I'm sorry.
No, there's not one body out there like the high school for the kids that's serving the more adult population.
Just thinking about, it's Commissioner Alyssa McKenzie, thinking also about domestic violence and stereotypically focusing more on women and moms. I think that none of anything that we're experiencing exists in a vacuum. So you have everything that we've just discussed. And then you have maybe someone who's been, for lack of a better word, successfully abused into not knowing that what they're experiencing is abuse. Then you don't even have that trigger to seek out help because maybe you have an inkling, but you're not necessarily thinking it's bad enough or it really is abuse. So you maybe haven't even looked into it on any level because of everything that you already have going on in your life and that factor.
That relates to a question you asked, Jackie. We did not ask in the survey, are you currently in care or have you been seeing a therapist or anything like that? But we did include 2 different screeners as part of the survey. One was the PHQ-4 and the other was a World Health Wellbeing Index. And so we asked more kind of how are you doing sort of questions. How have you been feeling in the last month? Not are you in care or not. So we sort of tried to map some of these things together.
Quick question, Lauren. This has all been fabulous, and I think probably a lot of usable, very real, usable, actionable data pieces. I do wonder if some of the orientation of some of the questions kind of leads people along a certain, not leads, but takes people in a certain way of thinking that then says, oh, maybe there has been a problem and they get identified into a certain bucket and then they haven't actually thought about like where to seek resources. Along with that, I think the survey, at least the way it's been reported out, has done a very good job of identifying the people who are at risk. One of the things our commission, I think, has been trying to highlight lately is how do we get more upstream? How do we figure out the things that can lean into that prevention piece? And so I'm curious if with the data you have, if there's an ability to look at the thrivers in town. What is working for the people who do report high life satisfaction? Can we identify the resources that they're accessing so that we can promote those more in town from an engagement piece and really start to get to that, as upstream as we possibly can. And so I don't know if given the wording of what's in the survey, if we're able to do that. And that's where I'm a little bit like, because this was so focused on behavioral health, I'm not sure that's there. But I wonder if that is something we can identify to say, it's actually, high involvement in community groups is correlated the highest with like great life satisfaction, or whether it's faith groups or, whatever it might be, that teases out, but actually looking at that.
That was part of the reason we asked all sorts of questions about your degree of involvement and in what kinds of things, right? We had like a list in there. Was it civic, faith, volunteering, parenting groups, all these different things. I don't think there was actually anything overwhelming that jumped out. It would have been terrific if it did. We were like actually ready to go with some programming. That's exactly what the survey data said. And it didn't sort of jump out that way. I think we also had maybe some hypotheses going into this around age. And I mean, what we saw was the populations who reported the highest life satisfaction were older. They were mostly through raising their kids. They reported higher life satisfaction, higher financial stability, overall better self-reported well-being. Now that is not across the board, right? We still have vulnerable populations in groups like that as well, but that was actually the trend that we saw. And so when we looked at what was going unaddressed, it really is kind of this more intense middle-aged population that I think was asking for more of a look. Those in the kind of 30 to 59 bracket were the lowest reported rates of well-being. Lowest life satisfaction was 40 to 59. And that 30 to 59 with the lower rates of well-being, like that was also the group that was accessing medical and mental health care services at the lowest rates. They're saying they had specific barriers where they weren't getting care in the past year. But to flip that, I mean, when you're asking about what's working well for the thrivers, I don't know if we quite got to that, or if that's something that we try to kind of put together in more of a narrative coming out of this survey process. And in terms of the way the questions were asked, this is the first survey, so we can customize anything we want going forward. And we can also do qualitative, add-ons. We can do focus groups or things to dig in and say, hey, we heard from this part of the population and we want to have a coffee group with, 10 people who feel this way, and dig into it.
Yeah, no, that's great. And I wonder, if you tie that to what the Surgeon General put out a couple years ago of parental pressures, right? And maybe that all kind of is consistent. I do remember kind of along that the family norms kind of piece is what's considered family norms that must be pulled from somewhere. Is that right?
Yes. So that's where the researchers' youth survey experience is really useful. There are kind of asset-based questions to ask in youth and community surveys about, family norms around, positive modeling, kind of the do you know where your kids are and who they're with, those sorts of things. Do you have specifically understood family rules around the use of substances or curfew or things like that? And so what's great is now we have a baseline of data, at least from the adults, the parents in our community. But it would be great to have the youth component to verify, yes, we do feel like we have these, family norms and rules. What our researcher has shared is, often in a community, you will ask the parents, have you had the conversation about this topic or that? And they said, yes. And then you ask the kids and they go, maybe, I don't know, like a couple years ago when I was in like 8th grade, but now I'm in 11th and we haven't talked about it in a couple years, so I think there is information in the survey data that begs for more support for parents as adults, as people, and then additional support for parents. And that's going to be constant, right? There's always going to be a next generation of kids and parents coming up. It was really heartening to see that a very high percent of respondents said they believe prevention programs are important. They believe that's a good use of dollars. So in terms of what Health and Human Services is putting into prevention work, right, that would be highly supported by the taxpayer, so that was great to see. But parent respondents, it was about 60% of survey respondents were parents, and then they went on to a component of the survey that asked them to think specifically about at least one child in their home. And so they do have concerns about their kids' mental health and stress and emotional well-being. And again, a lack of awareness of where to get support if they needed it. So overall, 1 out of 3 parents was not sure where to get support if their child was struggling with a mental health issue.
Can I ask a quick question? I wonder if, Nina, you keep talking about what the lack of awareness and 33%, is there any sense from Nina, maybe from other research, what percent would be appropriate? You're right, 100 is not reasonable, but, or are there people that don't know about resources because they don't need them?
I think that's that was a really hard area for us to benchmark, and every community is so different, and in other communities where there, let's say much higher rates that are low income population, right? They're just entirely different access and awareness issues. That area, I don't think she could give us good direction on, what it should be. But for us, I think when we dug deeper and saw, hey, some of the populations who would identify as needing a service were less likely to be aware, that gives us something to work on.
And you said what outlets are the best to reach them, right? Media wise.
Right. And I think, there's plenty of nonprofit organizations and others in the town serving these populations, right? So that it just gives us a little bit more information to go deeper.
Right. It's great. No, it's wonderful. This is really, really insightful, helpful.
One thing Lauren and I had talked about, Lauren, I hope I'm not like jumping ahead with, a good idea for you guys, but they had talked about if it's a media campaign or something that they do, and they have lots of people that can help with that. Because we find sometimes that people don't know what like Human Services does, or even Silver Hill, yet we all sit here and we're like, oh my God, we know what they do. But maybe giving like an example of like a mom could go here and get help, if you almost put it like can get help with like using the food pantry for a short period of time, like whatever it is, and Silver Hill, I had shared with them back, Susanna and I had talked about when the numbers were like down at some point, I said, could you get people to do surveys to say how much it helped them? Especially like there was a population of people, and maybe it was moms, to target like more moms to go if like a mom would step up to be like, this has been so helpful for me. I mean, I know Facebook Moms Group they're always giving out the urgent assessment, and people have great feedback on it, but one thing there, to jump back to what we were saying before, when in those earlier meetings, they've switched it now, and I think a bigger group of people at Silver Hill, I think it's their like outpatient is handling it now. But a lot of times when they'd follow up with the people didn't follow through with who they connected them with, and those therapists couldn't hang on to that slot forever. So that could have been a barrier, and it happens to me a lot. I mean, it's like I might give someone a therapist recommendation several times, and I usually just have to look up an old email I sent them and I resend it, and maybe they don't jump on it, right when it's given to them. So I do think that, and that goes back to probably what Marcy was saying, is they're not motivated when they're anxious or depressed. They're not thinking clearly, it's so hard, and they've got a million things to do. So, and we all know in our lives, how busy that can be. But I do think mapping out like a little scenario, not to give away, just to say, hey, you could go here for this, it might make someone think, and it's the repetition, and it couldn't hurt places like the Y Cares, because we do it. I do it in my newsletter. I had 57% open rate. I mean, that if you talk to people in those fields, like I think 30% was like a good benchmark of an open rate. It's 57% are opening the newsletter, and it's not only the fun things you can do with your kids, it's helpful things that you can do with them. The click rate, I don't know, I'm not a techie person to know if that's good, but people are clicking on certain links. But I do think us maybe quarterly sending out those resources. Like for instance, after this, I thought if there was a population of people that are new to town, I contacted the newcomers. When Lauren and I spoke the other day, they got back to me. They said they would love having like supportive resources to give. So we have, if anyone's seen that one card that was put together on like mental health resources, it does have urgent assessment. It has our department, and we only have a little bit left, so we'll give out what we have, and then we'll reprint it and correct the name of now the urgent assessment at Silver Hill. And if we could maybe add, like, but it's got domestic violence on there, it's got suicide prevention stuff. Like, it would be a great handout to go. And I don't know if they hand a packet or a folder, but they were agreeable to get that stuff. So happy to make sure they have that.
I think Jackie's right. The repetitive stuff, it's important. We all sound sort of like broken records, but in the mental health field, there's this like process of change, right? And so there are people who like in the back of their heads, they're aware there's an issue, but it's kind of like pre-contemplation, then contemplation and all that kind of stuff. So like, it's like the more you can repeat, it may then click and someone's like, you know what? I am now ready for change. But they aren't thinking about it when it first sort of hits. So I think just always reminding people of resources. And I don't think there's ever, like, you can never say it enough. So, getting it out there a million times, if it takes a million times, it takes a million times for, someone to go from there's no issue then to contemplating, you know what, there might be an issue. And then moving forward. And that process can, it's not a timeline, unfortunately.
Yeah, you can't correct substance abuse with one doctor visit, right? So I think, Barb, from my perspective, and I'm looking at the clock and the timing and everything, we've started great. I mean, Lauren, thank you very much, New Canaan Community Foundation, for the investment. There's a lot of information here and a lot of data to digest. There are a couple things that, to me, as a dad, now a grandparent, shot up as being a red flag. But we also don't want to go down specific rabbit holes if we think that there's services available and it's just continually exposing our community to those services and programs. So one that stood out for me, and I'll turn it back over to my chairman, is the access to substances. When you have 64% of underage access to substances for prescription drugs not prescribed. 64%. I would think that if we put us up against any other town, that would be extraordinarily high. But I think it would be great to have a commission to come up with, here's specific, as Rachel had talked about, that we can go upstream and try to hit and give priority to and support the New Canaan Community Foundation to support other providers in promoting accessibility to those. But we're not going to be able to address all of these at the same time. So it's picking those one or two, maybe even three things, and putting the full support of everyone behind.
Thanks so much. I think those are really great insights, Russ. And I think you're right. The next step for us is to talk about, how the commission, there may be more questions about the survey, and there may be more that, there's much more, I'm sure, Lauren, you'd want to share, but how the commission can move forward. And Peter's actually going to be running our next meeting, which is just going to be a brainstorming session. We're not going to have a speaker, and we're going to just talk about, kind of unpack what we're learning today. Peter, do you want to talk a little bit more about that?
Yeah, listen, this is such rich, powerful stuff. And, this group is quite knowledgeable, and, just the reactions are so interesting. And, we definitely had requests for more brainstorming exchange time. And I think that's what the next meeting will really be all about. The one bit of homework I would suggest is for everyone to think about one thing that they found most surprising and most significant. And, we'll go around the room just to sort of stimulate thinking, because this is a really knowledgeable group. And I'd be very interested, upon reflection, everybody, okay, I heard a lot, but this is the one that really jumped out at me. And then we'll go off to the races and talk about the implications of all of this. And I don't think we need to be definitive as a commission next meeting, but at least we'll tee up the implications, and maybe the following meeting we can really look at priorities again. But that's how we're thinking about actioning the work that's been done so far.
And I guess, Lauren, then I guess the next question for you is, what are things you haven't covered yet that you think are really critical for us to know about in our work? I know it's a big presentation, it's a big survey, but
there's a lot. I think what some were referencing around building awareness, I just keep coming back to not just a campaign around awareness, but something that makes it appear to the general lay person in town that New Canaan is really embracing being a healthy and well community, right? Because then that is a very positive framing, and it's not just, hey, we have these crisis services if you need them, and here's this thing to stick on your fridge when you're in crisis. It's something that would distinguish New Canaan from potentially other communities locally, to say, like, we are wrapping our arms around this all in a very positive way, and we have all of these great things lined up if you need them at whatever life stage you and your kids and others in your family are at. So I just think the town would be really useful in that effort, right? Because that the town creates a lot of what is that outward facing kind of culture to, especially to a large newcomer population to our town. And then the other thing I'll just say, we are, as I referenced earlier, still actively gathering feedback on how people feel about these initial results. But at least when we came out of that public forum last week, there was really the number one thing people said in the exit poll was the interest in administering a youth component of a survey. Because even the striking data you referenced, Russ, around access to substances, that's adult perception. We don't know, though, if that matches with youth behavior in our community and their experience. So, right, there's a lot of places in here we have to match up the data. Likewise, so I would hope access is actually lower than adults perceive. On the flip side, we had parents saying they had concerns about their children's mental health, but they're actually at lower rates than when other communities have asked their youth. And so we might find things that youth in our community would prioritize a little bit differently.
Right, and we have great resources. Jen has a huge distribution list for her newsletter, and so does Jackie. And like you said, the click rate is great. And Jackie, I was looking at it. I would encourage everybody, if you're not getting Jackie's newsletter, to email her and put your name on the list, because there's some really positive things going on and some good programming going on.
I think Jackie and Marcy and Jen are getting everything out. I think it's more to the general community and other partner organizations to figure out how to get coverage for those things. Like, did you know you could go to call someone and they can walk you through XYZ kinds of services? Because it's all there. Right. The town's doing a great job of it.
Right. And you look at your alliance, there's 30 organizations on it. You can't even see the logos. They're so small, because there's so many of them. Raquel, did you want to say something? No? Oh, I thought I saw you put your hand up. Well, anybody else this has been so helpful, and gosh, it's just so much to unpack. I'm glad we're going to have time at our next meeting to talk about it.
Lauren, can I just ask a question? What's the status of the youth survey? Is that making headway of timetable?
So we're in active conversations with the public and private schools. So it's kind of an ongoing conversation. We're optimistic, but really have to work out what exactly it could look like and how would it be administered. There's lots of examples of local communities either doing it within schools, or Greenwich, for example, does all public and private. Darien just does public. So it's ongoing. We don't have an exact commitment or time frame yet.
Okay. Thank you.
Okay.
On that, does it have to go through the schools, or is that just how it's traditionally done in other communities, or is it, because we got a decent response rate with just community engagement on the adult side?
It doesn't have to go through the schools. I think that is a backup option. We would again need to do a lot of specific outreach. And I think the fear is that we get those who are the most engaged in the community, right? Because if you try to administer it, you're going to go through the church youth groups and the Y and the places where like all of the joiners are. And that's not to say those youth wouldn't identify needs as well, but it would just be a risk that we would have a less representative sample than we could if it was in a school building.
But you have potentially the same bias with this survey that was done. And so you just have a sense of when there's trigger points, it's probably an underrepresentation of the actual trigger points, right? And so if you get significant results, then you probably really need to be pouring into those pieces, right? Because it's probably a bigger issue than than what's coming across, right?
Yeah. No, it's certainly an option. I think all the other, I don't know if I be correct in saying all of the communities I'm aware of doing youth surveys do it through a school.
Through a school. Okay.
Yeah. And then it repeats every 2 to 3 years.
So we
Lauren,
have,
didn't Dr. Lutzy say they do that?
So they do a
Annually or
school, they do,
biannually, whatever. At
they
the
do a
schools?
school climate survey. So, but that is, to my understanding, a very different kind of set of questions.
I think it's more focused on school environment,
Yeah.
right?
Yeah, I would think how they feel at school, like, you know, if, like classes, are they, you know, I don't, it's not getting into any of that behavioral health. Because that I think had been some pushback from not only New Canaan. New Canaan, as everyone knows, maybe not everyone knows, but we did that asset survey prior to me coming on in 2005. Joyce Sixsmith actually was the one that rolled out the survey with the schools. And I think then that survey started to add more questions around behavioral health and, you know, stuff that, and Darien, I think in the earlier days didn't have to answer those questions, and then they did if they wanted to continue on. But I do think, yeah, the school doesn't want to be put in a position if they ask that question, like, you know, could a kid be triggered that day? And then, you know, it's stuff around. And then some parents sometimes are unhappy with those questions being asked. I mean, in my 19 years, I know, you know, things that have, if they've had, you know, people come in to talk at the school or any presenters, like, you know, they haven't loved some of the, you know, stuff that they've talked about. So I do think it's stuff like that. So, but I had said to Lauren, maybe having, if they did get on board, maybe some identified youth could help with some of the questions, because I know that youth, you know, would definitely have good questions that they could ask, you know, like they're the ones we should be asking. But yeah, I don't know if that school climate survey is public on the website. I tried to look recently for something else and couldn't find it. So maybe I could see if I could ever see what one of those look like. I could ask Susan Bliss. I'll let you guys know.
yeah, it would be great to see that data. I'm not sure that they share it. Yeah, probably not. Yeah, I think it's proprietary, right? Okay, well, I've got like 5 more minutes, and we have to let Lauren go. Are there any other questions or thoughts?
I have a thought and I don't have an answer, but we had something like 13,000 people didn't respond. And we don't know nothing about them. That's a concern. And I know that the participation rate was considered to be good. So that's great. But it still kind of strikes me that we had most of the iceberg we didn't get a read on. And probably weren't ever going to get a read on it. But is there any kind of inference we can draw about those who did not opt in, and particularly the men? The men were a low low participants. It's almost, I get the impression is that you have the woman in the household. Well, I'll answer it. I won't bother my husband. I don't know if that's the case, but any thoughts? And any thoughts from our survey expert, Lauren, who you know who did the analysis and everything?
Yeah, so respondents, 75% were women and 25% were men, which she said is typical that females respond at a much higher rate to a survey like this. Some of it comes down to, say, if it went out, you know, in an email blast from New Canaan Cares or the health department, it is more often the woman in the family that is the point of contact for listservs like that. And so they might just be the respondents. But she did say that 25% male response rate is higher than she typically sees. So she was like, wow, all right, so you did additional outreach to get more men to care about the survey. It could have been lower based on what she typically sees. And yes, I mean, we would have loved to have heard from every New Canaanite. I think with the numbers we turned out, though, getting that confidence interval down to the 2.4%, that's where you could say, okay, well, if something in the survey said 25% of respondents, then you could say with fair confidence that somewhere between, 23 and 27% is your range of kind of accuracy, and you could extrapolate that to the larger population.
Yeah, it seems like a really robust response. Considering, yeah, I know I and my friends all encouraged our husbands to respond, but I don't know if they did or not, but multiple times, so.
Well,
I
and
think
it's a
so.
start, I think if this is a first go, and then if there does end up being repetition to this, and if we do successfully launch a youth component at some point, ideally at some point we sync up the time period in which we're doing the youth and adult together. And so I do think that could increase response rates as well, because if your child is being surveyed in one way, and then the adults are responsible for doing their component to make it stronger information, that could increase rates.
Well, it certainly was an incredible effort. You had so many volunteers who really worked so hard to put it together. I'm sure, sure you're very proud of that. We are.
Listen, to Tom's point, it's not definitive, but already there's been such a huge response. There's so much dialogue taking place. By any measure, this is already a huge success, and we're just sort of getting underway. And I just am thrilled with the way it's all gone. But again, this is, it's like commencement in college. Now the work begins, to learn and all that. But I think it's a big step forward, and I know we're very appreciative and frankly admiring of you and your colleagues, Lauren, for really moving the ball forward in a pretty profound way with this work.
Here, here.
Barb, you're muted.
Sorry. I just said we want to be partners with you in the next steps going forward. So please keep us in the loop and let us know.
Thank you. The full Alliance is excited about this too. And I should say the Alliance has a meeting kind of late February, early March to talk a lot about action planning and next steps. So this is all early days, but your partnership has been so important thus far. So we will for sure keep in touch.
All right. Thank you. Thank you very much. Really, thank you. Appreciate it very much. You're free to go.
Okay.
We're actually, we kind of covered everything. We really only have, the last item of business was just to talk about the newsletter, which I already encouraged everyone to ask Jackie to join. And I'm sure most people have Jen's newsletter coming to them, right? Is that true, Jen? Can you check? Just kidding. But if you don't, that's fantastic. And so, yeah, the only other thing, we already talked about our meeting for next month, and I'm not going to be here, and Peter's going to be leading that discussion as he outlined. So again, I love that idea. Just everybody think about the one thing they really want to unpack and discuss. And then the other thing is just the meeting tonight. And I have on the agenda that it's at 8 o'clock, and that's wrong. It's at 7 o'clock. So don't miss it. And I can send a link if anybody. I got the link for the meeting. Maybe I'll just forward to everybody, and that'd be nice.
That'd be great.
Great.
I know Marcy and Jen are going to do a great job, and so we're
No
very
pressure.
Do you want to talk more about it, Marcy?
No, I don't.
Okay, well then if there's anything else anybody wants to discuss? Okay, so we just have a motion to adjourn?
Motion to adjourn.
Okay, second.
Okay, all in favor?
Here, here.
All right, enjoy
Bye,
your
everybody.
survey.
Be
Have a
safe,
great day,
everyone, today.
everyone.
Have
Bye,
a good day,
everyone.
everyone.
Thank you.
Bye.
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 Drive and walk safely.
Yeah.
Yeah.
Good idea.